I'm still here with Dr. Herman Spies, and off camera we talk as much as on camera, believe it or not. So we discussed breast cancer and detoxification. I was just mentioning that the connective tissue is often where toxins detox into. And when especially women that do detox fat diets start feeling ill and they don't want to cope with the symptoms of a detox, and they stop. So they're detoxing into the connective tissue, which is often encapsulating the toxins around the breast tissue. And you can't detox your breasts.
Yeah.
So you brought two things to my attention that you, in your opinion, is factors for a high risk for breast cancer.
Yeah, absolutely. Because I do iridology in my practice on a daily basis, I started noticing that the patients that I saw with breast cancer, established disease, had these brown spots in their eyes in the breast areas. And I started questioning some of my other colleagues also doing iridology, and they started noticing the same thing. Now, we spoke to the Germans because they are the fathers of iridology, and they said no, those changes in the breast areas are caused by chronic inflammation. We said to them, yes, we totally agree with them, it's chronic inflammation, but what causes the chronic inflammation? They didn't believe us when we said we think it's parasitic infections, but after seeing literally thousands of patients, and I asked my colleagues doing the same to check for that, and we all came back with the same thing. There's a specific parasitic infection. It's called a trematode. You get roundworms, you get tapeworms, and then you get flukes or flatworms. And the fluke or flatworm family, the common one we've got in South Africa, is called blood fluke or bilharzia. Now, this is something that we get very commonly. I thought at first, because I come from the Gauteng area of the country, I thought it's something that you get on the eastern side of Africa, and the more north you go, closer to the equator, that's where you get it. But then when I started doing some research, I found the whole of southern Africa. There was a very nice website called mywormyworld.com.
Mywormyworld.com.
Mywormyworld.com. Unfortunately, that website has disappeared. But they showed that the whole of southern Africa, left to right, top to bottom, was colored dark blue. In other words, bilharzia high incidence.
Right.
Now, I started wondering, now, these spots that I saw on the lady's eyes, do they correlate with an incidence of breast cancer? And eventually we got to the conclusion that there are two things that commonly lead to breast cancer. Parasitic infections, that's mostly quiet. If I ask 100 patients that I know has got a parasitic infection, are you aware of it? Do you have any symptoms? 99 will say no. So most people are not aware of parasites. So if you have that parasitic infection that makes you susceptible because it blocks your lymph drainage, another name for bilharzia is lymph fluke or blood fluke.
Right.
So it blocks your lymphatic system, and then the breast area, especially if you wear bras and it cuts off your lymph circulation, is not able to detoxify as quickly as it should. And because your breast tissue is very sensitive to hormones, if you have a hormonal issue, xenoestrogens or whatever other thing that is affecting your own estrogen levels, if you have that in combination with the parasites in the breast tissue, that commonly causes constant chronic low-grade infection, and eventually it triggers cancerous changes in the breasts.
And xenoestrogen is hormones that you absorb through the environment.
Absolutely, and it can be anything as common as drinking water from a plastic bottle, because we know the plastic estrogens are even stronger estrogens than the body's own natural estrogen.
And I have to just make a point to say, you can have a BPA-free plastic bottle, but often the lid isn't. And then it sits in hot storage units and warehouses, and it condensates, and it just gets in touch with the lid of the plastic, and it goes through to the water.
But I heard that the one that we have to be careful about is BPA. And nowadays they've got all the labels on the bottle, it's BPA free and all sorts of things like that, and we all feel better because we're not using BPA bottles. But they've got other BPS, which is even more toxic. So we have to make sure that we drink water as much as possible rather from glass and other safer type of materials.
Sure.